Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to heal a blister. Most people have had blisters, painful or itchy bubble-like pockets of skin filled with fluid. A common type of blister is caused by friction, and though they can appear almost anywhere on the body, feet are particularly vulnerable to them. /r/n/r/n friction blisters develop when something rubs your skin enough to weaken the top layer, such as tight shoes. The outer skin separates from the layer beneath, and your body responds to the injury by creating a protective cushion of fluid. /r/n/r/n This article will explore what blisters are, what's inside them, and how to help them heal. /r/n/r/n Singh Rawat Getty Imagesrnrn/r/n/r/n When something irritates or injures the skin, it can cause a blister, also known as a vesicle. A common type of blister is a friction blister. /r/n/r/n Friction blisters occur when something rubs the skin, such as tight shoes or a handheld tool. They can develop if the pressure is repeated over time or if there is a short, intense pressure. /r/n/r/n Friction blisters on the feet are very common, especially in people who walk or hike long distances, such as hikers or soldiers. Factors that cause friction blisters in feet include /r/n/r/n Other than friction blisters, you may experience blisters due to the following causes: /r/n/r/n Blisters on your feet hurt because the epidermis, the top layer of the skin, which is less sensitive than underlying layers, has been damaged. The layer of skin underneath, the dermis, has more nerve endings, so when anything touches it, the blister fluid presses on the nerve endings. /r/n/r/n A blister looks like a bubble on your skin. You may have one or many of them. The fluid inside can be clear liquid or blood. Blood blisters may look reddish, black, or purple. Blisters are usually very tender to the touch, and pain is a primary symptom of a bubble blister. /r/n/r/n An open blister is one that has popped, further exposing the damaged area of skin. It may be very painful. /r/n/r/n Infections can occur in open blisters. If you see pus, your skin feels warmer around the blister, or you see red lines in the skin around the blister, you could have an infection. If you think you have an infected blister, see a healthcare provider. /r/n/r/n The clear liquid inside a friction blister is called serum. It is made of water, protein, and carbohydrates that leak from injured blood vessels. The serum has an important function because it cushions and protects the underlying tissue, allowing it to heal more quickly. The fluid will be reabsorbed as the skin heals. /r/n/r/n Blisters that are filled with blood form if your skin gets a severe pinch. The blood comes from vessels that were damaged in the injury and can have the same protective function as serum. /r/n/r/n Sometimes, blisters can be filled with pus if they are infected. /r/n/r/n Friction blisters generally occur on areas with a thicker layer of the outer skin, stratum corneum, usually the palms, soles, or other areas of toughened skin. /r/n/r/n However, you can develop blisters from other causes almost anywhere on your body that is covered in skin. Certain health conditions can lead to blisters on particular parts of the body or over your whole body. /r/n/r/n Blisters usually heal on their own. But you do want to avoid infection and minimize pressure on the blister to avoid pain. /r/n/r/n Healthcare providers recommend you do not pierce, pop, or unroof a blister, especially small blisters less than 5 mm in size. Doing so increases the risk of infection. Blisters typically heal within a week to 10 days. /r/n/r/n Here's how to treat a blister. /r/n/r/n For larger blisters, some people choose to drain the blister. This is best done by a healthcare provider. Wait a full day after the blister develops before considering draining it. /r/n/r/n. If choosing to self-treat, use a needle sterilized with rubbing alcohol to pierce one edge of the blister. Wash the area gently. Apply a thin layer of petroleum jelly. Antibacterial ointment may also be considered for a drained or burst blister. Cover the drained blister with a bandage to protect it from further damage. /r/n/r/n. Precautions you can take to avoid blisters on your feet from walking include /r/n/r/n. Infection is the primary risk for open blisters. If you see signs of infection, contact a healthcare provider for treatment. These signs and symptoms include /r/n/r/n. In some cases, blisters can indicate conditions that need medical treatment. These include /r/n/r/n. If you have diabetes or circulation problems, see a healthcare provider for any friction blister or other skin injury. /r/n/r/n. Blisters are bubbles or pockets of fluid on your skin caused by irritation and injury. Blisters are painful, but they will generally heal on their own. Keep the area clean and dry. Cover the area around the blister with a clean bandage to relieve pressure. /r/n/r/n. Help prevent blisters by wearing well-fitting shoes and socks and stopping activity if you feel a sore spot on your feet. If you note signs of infection, see a healthcare provider. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.